Where we are with the NHS because we've got yet another doctor's strike starting on Friday, and the NHS boss has said basically to hospitals, I don't want you to cancel all those planned operations. I want virtually all of them to go ahead. That's Jim Mackey. But how is that going to be possible? Well, let's talk to Stephen Dorrell. He's former Health Secretary and former chair of the NHS Confederation. A very good morning to you.
Good morning, Julia.
Thank you for joining us. Well, look, I mean, I know, an elderly relative of mine who had an operation cancelled, moved sort of, another appointment moved by 6 months because of a previous doctor's strike. But the NHS chiefs go, no, go ahead, keep everything going. How are they able to do that?
Well, when Jim Mackey says that he doesn't want to see any operations cancelled as a result of the resident doctors dispute, I'm sure he's speaking for everybody. None of us want to see operations cancelled for that reason. Which is why I think one of the reasons why I think the dispute that's being pursued by the resident doctors is so indefensible. We're talking about people who need treatment, who are on lists and have booked appointments,
and probably waited a very long time for them.
Waiting progressively longer for those appointments. And they're going to be told just before Christmas that they can't have their operation. They've got to wait even longer. So Jim's entirely right to say that we shouldn't be doing this. We shouldn't be in a position where the health service has to do it. But the unavoidable truth is that if doctors work fewer hours, then the capacity of the health service to treat its patients is reduced, and there will be fewer operations performed. I don't see any way of avoiding that.
And that's the reality, isn't it? And the government was elected on a pledge that they were going to sort out the resident doctors' strike, junior doctors they were previously called. Again, they're not junior, a lot of these people, they've been working for years and are highly qualified doctors. If you have an operation, it's very likely it's carried out by a so-called junior doctor.
Yes, you said earlier, Julia, whatever they're called now. Well, I do think the junior doctors was a misleading.
Yeah, exactly.
It was very misleading.
Absolutely.
These are senior people, professional people.
Yep.
Who should be looking after their patients.
Yeah, absolutely. But Wes Streeting, the health secretary, and he was a shadow. Look, we're going to sort it out. And they sorted it out by basically giving them everything they asked for. Was it 22% pay rise? And guess what? They've come back for more. Now, we know that support for doctors and nurses when they go on strike has been very strong in recent years. It's like, they've lost a load of money and blah, blah, blah. And now, actually, they do not have majority support in this country. A lot of people very angry saying, look, read the room. We have seen those pledges on providing more appointments. That's moved on. But we still know there is a productivity problem in the NHS. They've got a heck of a lot more money, but they don't seem to be doing a heck of a lot more with it.
Well, I think that is also true. One of the factors in the health service is that partly because people have been on lists for longer, some of the conditions have become more serious, so they take longer to deal with. And that's part of the reason, of course, for wanting to eliminate the waiting list. Yeah. So it's the old thing that if you prevent a condition developing, then the individual is healthier, and the health service is easier to manage. So you aim first to prevent illness, and then you aim to intervene early, not late.
Yeah, but we know the NHS was, to all intents and purposes, shut down to anything but COVID for 6 months, and a lot of people didn't get tests and routine tests that they would have got. But also, we are getting older. There are a lot more people who are older, and older people have a lot more ailments. Hi, Mum and Dad.
I have a mother of whom that's true too. Yes, you're right. But what you were also right in the earlier point, that there's a lot more money and a lot more people in the health service as well. So what we need to be better at in the health service, and I think that anyone who cares about engaging the health service, as I still am, we need to be self-critical about the ability of the health service to use resources effectively, efficiently, to deliver better outcomes for patients. That is to say, to prevent and to intervene early, to avoid conditions developing that don't need to develop. And of course, that's exactly the opposite of if we have extended waiting lists, we're doing exactly the opposite.
Yeah, absolutely.
We're making people wait longer while they get iller, so it becomes more difficult to treat them and they become more unhealthy.
And indeed, and we know that, especially with things like heart disease and cancer, the longer they are left, the likelihood of survival is and we're way behind other Western countries on survival rates for a lot of these things already.
A really concerning report from the Nuffield Trust earlier this week saying that only 3 hospitals are meeting their cancer waiting time targets.
And the cancer waiting time targets are obscene anyway, that you get to see a consultant 2 months after your GP says, oh, you might have cancer. I mean, people die in that time. It's quite...
That's true, Julia. I agree with you, and it would be lovely to have it in less than 62 days, but 62 days would be a big advance on where we are now.
Yeah, I mean, that tells you how bad things are, and that is not the case in most other Western countries who don't pay that much more for their healthcare. Just finally, I want to ask you about this NHS bonfire of bureaucrats. Wes Streeting has unlocked a £1 billion fund needed to basically pay for 18,000 redundancies. This is where he's basically axing layers of bureaucrats and managers, many of them highly paid. NHS England, Department of Health and Social Care and local care boards, basically amalgamating a lot of them. But you have to pay these people off, and you and I both know that after these sort of reforms, these people nearly always get a big payoff and come back about 6 months later on the same money for someone else.
But look, I wish Wes Streeting well. I don't regard him as a bad man at all. But the truth is, they announced a policy to abolish NHS England in February. Here we are in November, and they're now making another announcement. Oh gosh, in order to abolish it, we're going to have to pay somebody.
Nothing gets done.
Would it not have been better to have thought it through in February?
Wait a minute. Sorry, a government thinking through a policy and plan it? Stephen, it's been a long time since you've been in government. You're going soft in the head.
Maybe I'm out of touch.
Soft in the head. Stephen Dorrell, he's a former health secretary and a former chair of the NHS Confederation. Thank you very much indeed for that. Claire Pearsall, who's been listening to all that.
I do miss people like Stephen Dorrell, because he is very sensible. He knows how this works, and it's a shame that we don't plan better in this country.
We can't get anything done. There's your summary. Anything done. But not every single NHS reform has always involved paying off a load of people 6-figure sums and then hiring them back from similar sorts of salaries. But again, this doctor strike, I'm sorry, these doctors are completely not reading the room. No. People are done. And I know so many people who are really, really, low incomes, who've used all their savings to pay for operations because they know they're going to spend years waiting for a knee op or something like that. It's just not good enough. They're destroying the NHS. Like the BBC, they're destroying it from the inside. 11:59 is